In this video, here's what we'll cover: what OCD really is, beyond the stereotype, the OCD cycle, and why it persists, the many faces of OCD, why people hide OCD, and why it matters. ERP, the gold standard treatment. Imagine standing at your own front door, keys in hand, already running late. You've checked the lock, you know you've checked it, and yet a small, insistent voice says, "Are you sure? Check again." So you do, and again, 10 times, 20, until something finally feels right enough to walk away. Now imagine that same struggle playing out silently inside your mind, where no one else can see it at all. That is OCD, and in my practice, it is one of the most misunderstood conditions I treat. We've all heard it said lightly, "I'm so OCD about my desk. She's a bit OCD about mess." I understand how those phrases crept into everyday language, but they describe a preference for tidiness. Genuine OCD is something else entirely. It is intrusive, unwanted thoughts that cause real distress, and the exhausting rituals a person performs to quiet the anxiety those thoughts bring. Because it looks nothing like the neat freak stereotype, many people carry it in silence for years, unable to match their own experience to the public image of the condition. So let me start with the sickle that keeps OCD going, because understanding it is the foundation of treatment. It moves through 4 stages. First, the obsession, an intrusive thought, image, or doubt that feels alien to who you are. A loving parent might have a horrifying thought of harming their child. A devout person might have a blasphemous thought that contradicts everything they hold sacred. Here is something that surprises many people. Research shows that around 80 to 90% of us experience intrusive thoughts of this kind. What sets OCD apart is not the thought itself, but the meaning we attach to it, and the distress it creates. Second comes the anxiety, a powerful surge of wrongness and an urge to make it stop. Third, the compulsion, any action, visible or hidden, done to ease that anxiety or prevent a feared outcome. Hand washing, checking, and counting are the visible ones. But compulsions can also be entirely mental, silently reviewing, reassuring, or neutralizing one thought with another. And fourth, relief, but only for a moment. The obsession returns, often stronger, because the compulsion has quietly told the brain that the danger was real. This is the heart of it. Compulsions do not calm OCD, they feed it. Now, OCD wears many faces, and this is where recognition really matters, because you may not look anything like the stereotype. Contamination fears are only one form. There is checking OCD, ruled by doubt. Did I lock the door? Turn off the stove? Harm someone without noticing? There is harm OCD, where unwanted violent images cause deep shame precisely because they are so against the person's values. There is relationship OCD, with relentless doubts about a partner. There is religious and moral scrupulosity, where prayer or confession never seems to bring lasting peace. And there is what is often called pure O, where the compulsions are almost entirely internal, so the struggle stays invisible to everyone around. This brings me to something important: why so many people hide OCD, and why that matters. When the intrusive thoughts involve harm, or sex, or morality, a person often becomes convinced that having the thought makes them dangerous or bad. The shame can be enormous, so they conceal their rituals, arrange their lives around avoiding triggers, and tell no one. Sometimes for a decade or more. But untreated OCD tends to expand. The avoidance grows, the world shrinks, and by the time someone reaches my room, they are often carrying depression on top of it all. So I want to say this plainly. Intrusive thoughts about harm or morality are a symptom of OCD. They are not a window into your real character, and they respond to treatment. Which brings us to the treatment itself. The approach with the strongest evidence for OCD is exposure and response prevention, or ERP. It is a specific form of CBT, and it works differently from simply arguing with the thoughts, because people with OCD usually already know their fears are unlikely, and the doubt returns anyway. Let me be clear about what ERP is not. It is not flooding, and it is not throwing you into your worst fear and demanding that you cope. It is gradual, collaborative, and always done at your pace. Together we build an exposure hierarchy, a personal map of feared situations, ranked from manageable to hard. Then, step by step, You face a trigger while deliberately not performing the compulsion. Someone with contamination fears might touch a door handle and wait before washing, then wait a little longer, and eventually not wash at all. Over time, two things happen. The anxiety settles, and the brain learns that the feared outcome does not arrive. The goal is not zero anxiety, or a mind free of every intrusive thought. It is the freedom to have a thought without being ruled by it. How long this takes varies. Milder presentations may improve within a couple of months of consistent practice, while more complex ones can take up to a year. For moderate to severe OCD, medications such as an SSRI, discussed with your GP, can be a helpful support alongside ERP. If any of this sounds like your own hidden struggle, please know that effective help exists. At Potentialz Unlimited in Bella Vista, I offer ERP-based therapy, with Medicare rebates available through a GP mental health care plan. You can read the full guide, or book an appointment, using the links below. Reaching out is not a weakness. It is one of the most courageous things you can do. Before you go, here's a quick recap of what we covered. What OCD really is, beyond the stereotype, the OCD cycle, and why it persists. The many faces of OCD, why people hide OCD, and why it matters. ERP, the gold standard treatment,